Thanks so much for staying with us, everybody. Singing River Health System sale halted back in October. That after negotiations ended with the Franciscan Missionaries of Our Lady Health System. They're based in Louisiana. So what's next for the Singing River Health System? Here to talk about that, Singing River Health System CEO Laurin St. Laurin, good to see you, and thanks for coming in and talking about this, because this is a big story, not just for Jackson County, but really for all of South Mississippi.
Yeah, Dave, thanks for having us on. And as you mentioned, FMOL did decide that they could not reach an agreement with the county supervisors. I'll remind you that that is where the negotiations were taking place between the county and FMOL. And ultimately, healthcare is a challenging environment right now, nationally as well as in the state of Mississippi, and mergers and acquisitions are actually on the decline. Not the bounce back that most were hoping after COVID. So ultimately there were the negotiations are actually going on.
Well, it seemed like they started out on the right note, and then as it got down to crunch time, it seems like Franciscan was kind of changing the rules a little bit. I know you can't comment much on that, but changing the deal a little bit. But I want to ask you, I don't live in Jackson County, but my guess is that most residents would prefer to see the health system owned and managed locally.
Well, let me tell you this. I think that we've obviously been in the healthcare business at Singing River for a very long time. We have done a very good job. Quality has always been our number one focus, and has been through this entire RFP process. And the one thing that I will tell you is that when we decided to go through an RFP process, we wanted to do it from a position of strength, which we were. And the fact of the matter is we continue to be at a position of strength. So this is not a failure on anybody's part. It's not a failure on the health system. It's again just the environment with mergers and acquisitions basically could not come to an agreement.
Considering, I'm going to get you, I'm hearing your mic make a lot of noise. Just move, let's fix this live on TV. Let's get it away from your tie.
That good?
Unless it's something else. Never done that before. It was the first time for everything. It was bugging me. So, not your fault. So, are services the same? Is this hospital system in good shape financially and in terms of keeping staff and providing services right now?
Yeah, no, absolutely. Again, that was my point, is that the health care system is still at a position of strength financially. We continue to do that. The employees that we have in our health system, the physicians that we have, are top quality. That is the reason why we're successful, and that's the reason we'll be successful moving forward.
There was a time, Laurin, before the Franciscan deal showed up in the news, where Ochsner's was considered a partner. They're in New Orleans. Is there a possibility they might be back in play, or where negotiations might reignite?
So we still have a strategic partnership in place with Ochsner. Ochsner has been a good partner with us for several years now. As most recently with our cyber attack, they reached out to provide us some help so we can make sure we continue to take care of our patients in the best way possible. So they continue to be a good partner. We're going to continue to evaluate other partnerships that are out there and continue to strengthen our partnership with our county
So
supervisor.
I'll just throw some numbers out there. There's a I believe, and correct me if I'm wrong, $58 million really on the table for the pension plan, about $60 million for bond debt. The Franciscan deal was supposed to take care of that. You also want to retain employees. You don't want to see any kind of job cuts. You want the insurance to stay the same because they have a great insurance plan over there. Franciscan was kind of playing around with some of those things, those numbers a little bit, and you guys didn't like it, so you said, we're not taking this deal, we're waiting for the best possible deal?
So again, the county was doing the negotiations, but here's what I can tell you, and this was actually on their website, but there are minimum requirements that were put into the RFP process, and those minimum requirements were about keeping employees that were in good standing on for a certain amount of time, making sure that services that were currently offered by Singing River stay, making sure that our EDs remain at all of our hospitals. And if any particular point in time the county believed that those minimum requirements were not being met through the asset purchase agreement, then they can pull out. And that's exactly what took place.
Okay. So I agree. Don't be in any hurry. Get the best deal possible, right?
Sure.
That helps the people.
And again, could not be more pleased with ultimately, again, FMOL is a great health system, but at the end of the day, the county put out an RFP to get certain things, and at the end, they felt like that was not going to be delivered.
So right now, I believe Singing River, all hospitals, Singing River gets from the state about $9 million. Governor Reeves has talked about increasing that number for all hospitals around the state, and that could be up to $40 million, I'm hearing, for Singing River Health System. How helpful is that going to be?
Extremely helpful. Again, it still has to get through the CMS process, and it could change a little bit by the time that actually would occur. But again, very optimistic that the governor has put that out there through the MHAP process, and again, drawing down federal dollars coming to all of the hospitals across Mississippi. But $39 million to Singing River Health System will certainly be beneficial.
Well, do you think the legislature and the governor appears to have heard the plea of hospitals? And I think the coastal delegation and the Jackson County legislative delegation appear to be receptive to all of this. Are you confident? Are you doing some heavy lobbying?
Yes, and could not be more proud of our coastal delegation. Obviously, they're very influential across the state, and again, have been very beneficial and are supportive of this. Yes.
Laurin St, thanks for a kind of an inside look at what's happening at Singing River Health System, and thanks for being with us on the show. I sure do appreciate it.
Dave, thanks for having me.
I hope to have you back when we get some more information.